This video is looking at scoliosis and massage. Scoliosis is a back condition that causes the spine to curve either to the left, the right, or in an S shape. Up to 10 degrees is considered within the normal spinal range, so scoliosis is only diagnosed when the curve reaches 11 degrees or more. How massage is approached will depend very much on the severity of the scoliosis. Some scoliosis will cause the pelvis to be tilted, and for this it's important to start by massaging the feet, then up the legs, then move on to the hands, the arms, the head, the shoulders, the neck, the back, the sacrum and hips. But there's two key aims for massage for scoliosis. The first is to ease continually overstretched muscles to allow them to relax, and secondly to reduce the muscular strain on the spine and increase the flexibility and reduce the pain in the whole body. Understanding how the scoliosis affects the rest of the body will help you focus your treatment and make it more effective. If somebody had quite a severe curve, all you would do is you would follow the curve. So you'd either follow the C or you follow the S curve. So just make sure you're being really careful in your positioning around the spine. So you can see here I am on the muscles either side of the spine as I'm coming right down to the sacrum. So with a scoliosis you would simply follow the spine as it went. Usually if somebody has a fairly developed scoliosis, their spine is fairly obvious. It's not usual not to be able to find the spine in somebody with scoliosis. It's usually fairly obvious. It can be harder with like builders and bodybuilders, people who do groundwork, where this muscle might be so tight that it's like you know that that's muscle because anatomically you know that's muscle, but it doesn't feel any different to bone. With scoliosis, that tends not to be the same issue. So you're following down beside the spine. Here we're doing this warm-up work. You can see I'm gradually increasing my depth. Although I'm coming up here with my hands, I will still do that with a scoliosis, but I'll do it more gently. So I will come up kind of that way, depending obviously where the scoliosis is. What you need to make sure is if you're going and you're putting pressure on both sides of the spine, you need to do it equally. So don't put more pressure on one side than the other, and err on the side of caution. If you're not sure about using the side of your hands, then don't do it. You know, if in doubt, don't is not a bad mantra. We then need to get in under here, under the shoulder blades. So to do that, I'm going to lift Daniel's arm. Again, he's very flexible here. You can see we get a nice raise here, and I can get properly under there. So you can come up in one sweeping movement, or you can start from the spine and come out. When treating someone with scoliosis, I tend to do it more this way. I'll come out from the spine. And you're also starting that intercostal work because you're starting to pick up the ribs as you get lower down. Now, if somebody can't support their arm there, I will just hold it, or if they can only get to there, then you work to there. Work wherever your client can get their hand. So don't make it as though they're kind of straining at the front to do it. Now, when you're working with scoliosis, and you've done this warm-up work, remember this is only warm-up that we're doing both sides of the spine together, to then do the more detailed treatment where you're pressing and holding and feeling for tension and using that static pressure. So you can feel the tension there. You always start with the inner curve first. So you're going to work both, but work the inner curve first. So where we're doing it both together, that's just the warm-up work. I'll just be really clear on that. This work here, just the warm-up. This deeper work, static pressure, and you might slide across the muscle as well, particularly out towards the scapula. Where you feel that resistance, just hold it, but always work the inner curve first and then work the outer curve.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.